Hey, great. So this is the third webinar and step B, and I'm so delighted to see all the people all these smiley faces, ready for ask some questions later. And yeah, so this step B has got so much details. It's incredibly rich. It's incredibly transformative for your practices. So I really hope I can impart the key aspects of it in the next couple of hours. So let's get cracking, and I shall share my screen. Okay, so step B. Right, so this is the 8 extras, or actually, I call it the sides of pulse method in my new writings, and this is, well, it's all about the 8 extras. That's the main feature, but the main way that we do it is with the sides of the pulse. So, while here is a small artery I have to show. So when I say the size of the pulse, basically that means not just the top part, but the inside and the outside as well. So this is kind of like a new perspective on the pulse, or rather the artery that we have. The artery has got sides, including the top. So there are three main sides we can feel: the one side, the top, and the other side. So this is split into 3 sub-steps. B1 and B2 show all about the extraordinary vessels. And B3 is now called the 9 pathways method, and that shows imbalances in the low collaterals. So it's a really brilliant step. I'll explain much more about exactly what it's showing, but just right now, think of this B3 sub-step as being all about kind of muscular imbalances, obvious imbalances that are physical, not so much to do with the organs. But I'm becoming more and more excited by this step, as I find it does show some really useful things. So a subsidiary goal of this phase is to show very precisely where the position of the radial artery is within the space that it normally runs. So that means that you know exactly where it is. So if I'll just come off the share for a sec. Stop share. So if we have this artery and we expect it to be in a certain place, we expect it to be here, but in fact it's moved, and we miss it, then we're not on top of the artery at all. This is a really interesting and useful thing to realize, that the artery does change position. It can also change a position like this. So maybe one of our fingers is on it and the others are missing. So that's a very interesting perspective to have. Sorry, just share. What can you see now, Karina? Can you see the big screen?
I can see a slightly fuzzy white picture with a kind of funny thing on it.
Okay, could you just stop the recording? Okay, so step B, it's got, I'll just go back to the past one. Yep, so the subsidiary goal is that it precisely helps you assess the position of the radial artery within the space that it normally runs. So that enables the next bit, step C, to be carried out accurately. So that is actually really useful, and that almost would be a reason to do this step B, even if you didn't get anything else from it. On a practical note, with step B, we are using all the 3 fingers together as one unit, but we're kind of activating the fingers in, they're still moving them together, but you just move individual fingers a little bit to be able to feel the whole artery. So I'll be able to explain that a little bit better when I do a demonstration. We're going to try and do an actual demonstration in this webinar. Okay, so this there's different sources in the Jing for this. For B1, for the three midline extraordinary vessels, which is Chong, Ren, and Du, we've got Book 2, Chapter 4 of the Jing, and the rest of it, the B2 and B3, that's all from Book 10, and they all of these three sources have got a similar sort of feeling about them. They're a bit different from the rest of the Meijing. They have more of a sense of a practical application. I kind of think that they might have been written by Wang Shuhe, the person who compiled the Meijing, or it's from some other lost classic that is no longer in existence. So it has got they've got a special kind of feeling about them. And together they make the title of Book 10, together they make up this puzzle, which is um, the title of Book 10 is the hand diagram of the 31 positions. So this is this really peculiar phrase that people have struggled to understand. What on earth could there be that has got 31 positions? Or in fact, a bit of a puzzle is, even though it says the hand diagram, the actual book has not got a diagram in it. So there's another thing that's a bit strange, that people don't really understand this. So it's been a bit enigmatic, and it's kind of contributed to a feeling that the Meijing is a bit kind of chaotic or not reliable. But there's actually a really good explanation for these 31 positions. And at the end of the seminar, I'll kind of show you how you can make 31 readings of the pulse. So it's not as kind of crazy as it sounds. It's quite it's quite realistic, and it also gives you a reason why the method is done in the way that I do it. So it's quite a nice kind of solution for this 31 positions. So hopefully that's not confusing. Stay with it. If it is, it will all become clear later. So we talked about this in the first webinar, but just to remind you that this now really is important, that we are feeling the artery. So in step A, even though the artery is there, and I mentioned this earlier, I don't really mind if you want to just have your fingers coming in from above and just being in the pulse space and just having a sense of what's there, if it's full, if it's strong. But for the case now, for step B, we're going to be using the sides of the pulse, and this for that we shouldn't just say sides of the pulse. We're talking about sides of the artery. So this is a key thing for you to change in your mind the idea that it's an artery that we're feeling. So we can use anatomy to help us visualize. So here is this slide has got a slice through the wrist that shows the anatomy. So I am actually, Karina, I'm going to get you to stop again. I need to sort out my PowerPoint. All right, so yeah, so we can use anatomy to help us visualize what's underneath. So when we have a sense of this, our wrist here. So this is basically a slice through our wrist like this. When we have a sense that right in here is our artery and that we are going either side of it, this is super helpful to realize that there are sides to it, and that this is a real thing inside the wrist that we are feeling. So let's have a closer look here at what you can feel. So here is the actual artery itself in blue. And we can we can usually easily feel the structure. Should really make it red. Okay, there's the artery. Okay, now that's what you feel, obviously. We can usually easily feel this tendon that is ulnar to it, towards the little finger. So that's a kind of landmark that is really reliable. There is another landmark, which is this edge of the bone, which is the crest of the styloid process of the radius. So that's less obvious. It kind of the artery is kind of sits in this sort of trough or space, and I like to call this the pulse space. And this is just nice to realize that there is a sort of simple space that it sits in. Above is the skin, and below is the bone. In fact, there's a muscle in there as well, but the main thing you feel as you go down is the bone. It does have a bit of space above and below the artery itself, so it is sitting in a space of sorts. So it's got a little bit of space above and below it. Okay, so we use a special kind of movement to try to palpate this, and I will try and demonstrate this best I can. It's in fact, I've got some pictures of it. Maybe the pictures show it best, but I'll just say what they are. The first position is from the side with three fingers. That's called pushing. The next position is called hook and pull, where you hook over the pulse and pull it towards you. You hook over the artery, pull it towards you a little bit, and then you let it go. It finds its own space, and then you settle on top. So it's got three bits to it: pushing, hooking and pulling, and settling on top. So this is what it looks like on the left, pushing from the side. And then second one, hooking. So you have to really lift your fingers up and the pull, hooking into the space that's in between the tendon and the artery. I'll just go back to show you one more here. For this motion, you need to really get your fingers into this space here, hook them round, and then pull in this direction. And when I say pull, I mean I'm only just saying pulling like a little bit. It's like almost to be sure that you've got your fingers inside on the inside of that artery. And you can see that sometimes there's only a tiny space here, but you usually can get your fingers in there and pull towards, or at least sense what's inside that side. This is where I'm just doing the red now. That is one of the sides. That's the inside of the artery. And I'll just draw the outside. The outside is here, and the top side is the top. E. Oops. Okay, so the notation, as I have mentioned previously, does build on this system of this so-called T-shape system, with the left side of the diagram being the left side of the body, the right side of the diagram is the right side of the body, and the top of the T represents the wrist bone, and this kind of body of the T going up and down is basically a demarcation of left and right. So just to remind you that you would be looking at the hands like this. So you would have it's basically a view of the hands in this sort of position. So just in case you kind of get lost thinking, well, what am I really feeling? You are feeling the artery, let's say this left artery, you're starting on heart, and then there's liver, and there's kidney yin. So that's really what's going on there. And on the other side, you have lung, spleen, and kidney yang. So this is the actual artery, and it's about that big. How I drew it. So pretty small. Amazing to think of it that we are focusing all of our energy and focus onto such a small thing. So obviously, that's why it can be tricky learning pulse diagnosis. But as I'm hoping, having something systematic can help bridge the gap and make it work better. Okay, so sometimes we for this right hand proximal third position, sometimes we call it triple burner pericardium, and as many people think of it as kidney yang. So that's completely fine if you want to think of it either way. In a way, it's quite interchangeable. I don't mind. I don't mind it being somewhat fluid, exactly what it means, because in different contexts, the 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 actual meaning of that is clearer one way or the other. So, as I mentioned, this whole space is a useful idea. So we have the skin at the top and the bone at the bottom of the space it could be in. If you sort of did it in 3D, then would be disappearing off into space like this. And here we have our artery sitting somewhere in the middle. Okay, and here we have the inside. This was done by the hooking and pulling. And the pushing, first of all, on the outside, the hooking and pulling, and then settling on top for the third way. So this allows us to find three sides. So this is the inside. This here is the outside. And here is the top. Okay, so unfortunately, you can't feel the bottom of the artery, but we've still got plenty we can feel with these sides. And the most of the findings for the I mean, actually, most of the findings for the extraordinary vessel is either from a going in from the top or something to do with the sides and the way that the artery is with the sides. So that's most of this step B is to do with this perception. Okay, I feel like maybe this is good time to ask for a question. If there are any, or if there aren't any, I will keep going. Any questions?
This
Please?
is new material for me. I haven't heard about it before. It's new for
Yeah.
me.
Oh
Mm.
yeah. Yeah. It's do you I mean when I first heard about this, I don't know how you feel.
Mm.
I felt absolutely amazed that there was something that was uh so different,
Mm.
but yet actually written down in the classics.
Mm.
I mean,
So interesting. Then just can't go on.
go
What
on.
are we finding?
Yeah, so I think it's absolutely amazing that it's
Mm.
actually in the classics. Karina,
No, I just wondered, is now a good time to demonstrate like the push and pull and hook
yeah,
or
do you want to come? Do you want to come straight through, and I'll try and do it on the I'll try and do it on my table. Okay, on. So let's go back to the It's great. In fact, no, I'll just do it with Karina. You can just bring your arm here. Okay, great. All right, so just to give you a sense of the orientation of things, so let's just see, this is her left hand, this is her right one. So
Kneel down.
yeah, okay. What you want? You have to stay there.
Right.
Closer. So look, this is my yeah. So I'm going to do this not so like normally, right? I would have it like this. Okay, I would be doing pushing, pulling, and settling with the wrist in this position. So remember, all of this is in this side position, and really the majority of the information comes out because the wrist is in this position. So it does not work very well if it's not in this position. But just to show you what this looks like, I'm just going to be rotating the hand out to show you what to show you what it looks like. So those images I showed you before also were like this, and actually not in the position I use, but just to show you. So look, this is, in fact, can I just draw the artery? In fact, I'll show you the other features of the anatomy. Since you're here. Okay, so look, here's the tendon. Here's the top of the bone. And in here is the crest, or it's the edge of the radius bone. Okay, so that's the space where it could be sitting in. And so in here.
I can actually see it pulsing sometimes there, in that space there where your finger is.
Yeah, I'm just very carefully going to feel how big it is. Okay, there it is. All right, so that is the radial artery, our three fingers. So just a reminder about positioning, in case we haven't talked about this. This is very useful to do this right now. In this around the middle position, you can feel that this bone has got a summit to it, and you can easily feel the most large aspects of it. What you should try and imagine is imagining I've got a line on my finger like this, and that there's a line in the middle of that. This is going to be the second position. I want to line up my middle finger with that line and move over and look for the artery in the space. And then the first finger nestles in between it and the edge of the bone, and the right one makes a similar space to the top. So it should be kind of even, the space between this. Basically, they should be touching, but it depends on how big the person is. Okay, so that's the exact way of finding the pulse. It didn't matter so much in step A, but now it really does matter to be really, really accurate. Okay, and here is the tendon. That's obviously it's not the tendon. I have naturally gone onto the pulse, but I'm going to show you the movement. So first of all, there's pushing, like this, push, and then lift, hook. Hold on, get the man back in. Okay, so start again. Okay, here we go. So push, and then hook and pull, and then settle on the top. All right, so I'll do that again. Push, hook and pull, and settle on the top. So that's basically what the movement looks like. I think I'll just temporarily, could you just hold this?
Do you want to demonstrate it in this position?
Yeah, oh, that's good. Okay, I can do it. Okay.
I can hold that.
No,
like
I've got it. I've got it. It's fine. It's good. All right. So here's the artery in a more of an accurate position. I think you can see how actually everything gets softer. Can you see that? How everything's softer in this wrist like this. So push, hook, pull, and settle. I was kind of hoping to get a view underneath. Maybe this will work.
I can hold it.
Okay.
Oh, no, I can't.
No, it's all right. My other hand. No. Okay, so push, hook, pull, and settle. So there are three bits to it. Push, hook, pull, settle. So that's the simplest way of doing it. There are some varieties. You can also push with little pulses. Push, 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 lift, hook, pull, 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 and settling on the top. So you can do it in this kind of way. Pushing, pulling. Because you need to have a sense that there's actually something there underneath your fingers. If you're trying to do this on your own hand in the way that we often can, you can just about feel it if it's but it can be tricky. But anyway, that's the motion. I think that's clear enough. Was that clear? Yeah, good. Okay, I think that's it. Thank you. Alrighty. Yeah, so that was about the sides of the artery. And this is what we were doing. So we were pushing in from the outside, hooking and pulling and going on the top. So that gives us quite a lot of information. So that's basically how you do step A. Step B, this side pulse method with this sides of pulse approach. So here we'll go into B1, which is called the three extras method. And this is for the three midline extraordinary vessels, which are the do, the ren, and the chong. Okay, when I say mid, they're the ones that are found on the midline. So obviously the do is on the back, the ren is on the front, and the chong is right in the middle. Um, these extraordinary vessels, little reminder, are super important. They've got this super important connection with prenatal chi, with essence. They're very kind of primal, extraordinary vessels. They kind of control so much of our body's physiology. So there's a lot that we can explore with them. This method, the excess is really when there is excess, it's really easy to feel it. Feeling more deficient presentations is more of a knack, but you can develop it. Um, Finding deficiency is a skill that is kind of related to the previous step of the three levels. Where I don't know if you recall, I was talking about how sometimes it's you've got to kind of relax into the method to feel emptiness when just basically where is there emptiness? That is a much harder to feel. And using the three levels does get you a bit closer there. It is definitely more advanced though, so just something to work towards as you get more and more confident in this kind of approach. Okay, so we use all three fingers together as one unit with this method as before. So the B1 is just about the midline coming down. All right. So this one has not got the sides. This B1 bit for do, ren, and chong is only from the top. Okay. And just looking on the right hand side, the right hand side of the diagram, if you have a finding, let's say on the ren, you could just draw it above the T. That's how I used to do it before I wrote my book originally. And found it was too complicated to just put this in my book, but it's still useful. If you had a do, it might look like this. Whoa. Very large finding chong might look like this. So they kind of feel a little bit when you access them. Um, the the important thing about this is that the fingers come down from above exactly vertically. So that's why the pushing and pulling to get exactly on top, to go in a perfectly downward direction on top of the summit of that artery.
Jamie,
Yes?
is it possible to demonstrate on the cushion behind
Yeah.
you?
Yeah. I'm going to demonstrate. Thank you for asking. I was just about to. Or I can show it on here. All right, so what I'm talking about is, well, I'll show it on here as well as with my thing. So basically, when you are palpating, you're coming down onto the top, exactly on the top. So you felt from one side and the other, and now you're settling exactly on the top. And you will then find it basically in there. In fact, I will also go back to this other slide that will give, yeah, so we're talking about the pulse space. And I will just now discuss something, which is, let's say we've got the artery. Okay, so we felt it from one side and the other, and now we're going to be palpating on top. What this will look like from the side is, in fact, that is not a good way of doing it. Okay, I'll come off the just come off the share out like this. Okay, so the pulse space, I've showed this this thing before. So this model is a model of the pulse space, and you can see that you've got from the skin down to the bone, or from one side to the other. And here the artery is sitting inside the space, and basically the when the artery is got one of these presentations that we are thinking about for the extraordinary vessels, for the B1 ones are Du, Ren, and Chong. The Do position is really high, right at the top. The Ren position is in the middle, and the Chong position is at the bottom. So the Ren is somewhere in the middle, and the Do is right at the top. And the characteristic feature of this is what is called a vertical movement. So a very strong striking upwards vertical movement of the whole artery. So it's incredibly distinctive. When you feel this, you will have the sense that have got your fingers on something that is that you can't push down. You can't obliterate this. It will it won't let your fingers in. So even though you might be trying to palpate to feel qualities or something, you can't feel anything at all other than this really strong upwards beating quality. And that's how you know that you are witnessing one of these three midline pulse qualities. So that is when they're in excess, that's how they feel. Um, when they're deficient, you still feel them, but it's like a ghost of this full one. So a deficient one is just a softer version of this big one, but you just kind of need a bit of experience feeling the strong ones to be more sure. So it's the precisely upwards vertical nature that makes this so distinctive. It's like a battle ropes. You know what battle ropes are in the gym, where people pull them up and down and they beat. It's a completely upwards beating that this artery has, that your fingers are touching on top of and palpating down, but you can't get your fingers into the artery. They're being pushed off. It's especially with the Do pulse. It's they're super strong and very distinctively kind of large. Um, Now I wonder if this would be a good time for us for another question. So any questions? Because you may or may not know what I'm talking about at this point. Any questions? No. All right. I so One of sometimes what people say at this point is whether this is the same as a wiry pulse or a very forceful pulse. And the truth is that often people mistake a wiry pulse for this feature. The wiry pulse actually is like a sharp pulse that you have your the artery feels in some ways sharp, like a very taut wire. But this feeling is not like that at all. It feels extremely large and extremely forceful, and as if it's trying to escape upwards out of the wrist. Um, so the next time you have somebody with really bad back pain, you could easily have a do pulse there. Um, so that might be one of the easier ways of starting to do this out for a strong upwards feeling artery with somebody with strong back pain. Does it make sense? It's you in a way you need to start with an obvious manifestation of it, and then once you get used to it, you will be able to feel it much more easily. So,
Jamie,
any yes?
yeah, it's a quick question. So I'll actually put my video on now, so I'm not just a disembodied voice. So yeah, so how common are these findings, these extraordinary vessel findings, would you say?
Yeah, that's a really good question. Perfect question. So, when I have people, well, it does depend on what your patient's body is like, but when it's what I would call for me, like an average patients, for me, my average patients are about half of them are for musculoskeletal things, and about half of them are for other things. Okay, so just roughly speaking, it's that. So I'd say out of the musculoskeletal conditions, um, maybe a half of those are extraordinary vessel findings. So there will be extraordinary vessel findings in half of them, um, depending on what kind they are, but especially when it's things like back pain. Extraordinary vessel findings are really, really common in back pain. Now, the longer the pain's been there, the more likely it's going to have extraordinary vessel or extras, we could call them. The longer the pain's there, the more likely the extras are there. So when somebody has had something all their life, or something like scoliosis, or things like unusual curvatures, then it's more likely than not that they'll be in one of the eight extras right there. Um, so that's been my experience of it. Also, they do come up in other circumstances, like emotional things. And I hope I'll be able to do a case study of somebody who's been coming recently with depression, who actually has got a Do My presentation. So it's been a really, I mean, I just couldn't believe it, but that's what it was. So I think I mentioned in my first webinar the idea that I ask the Pulse the question, Pulse, please tell me what to do. And for me, it's a really exciting process to be not sure about what I'm going to be finding, and then putting my fingers on, and then finding something completely unexpected. And I always think that that is um, like an eye-opening thing. If it makes sense, or at least can be, if I can think, oh, okay, I see why that could work, then I'll go with it and I'll treat it. So usually I follow the pulse to tell me to do the extraordinary vessels, and I use the pulse to give me the direction to do the extraordinary vessels. I don't tend to choose to do the extraordinary vessels from my book learning about what they're meant to do. I mean, I very, very rarely do extraordinary vessels from a theoretical perspective. It's usually only from the diagnostic one. And I believe that process, I have a belief that process the ability to do the diagnosis. It almost brings out the ability to palpate the artery like that, because I have a sense almost that the artery will show itself to say, okay, this is what I need. This is what the body needs. So it comes really clear. So all in all, it's about a third. I'd say it's probably about a third of my new patients. So of that, then in many cases, the extraordinary vessel presentation goes away with regular treatment. I do have a couple of people who are long-term patients with long-term imbalances who always have extraordinary vessel findings. And so for those people, the extraordinary vessels, the extras are not being resolved by treatment, but they get resolved within the treatment time. So what I mean by that is, after I've put the right points in for the artery, let's say it's a do and it's floating really high up, and I put small intestine 3 in, then it should soften and go back to the middle. And that's a sign that it's healthy, and that it's gone, and that at that time the extra is not active anymore. So in a way, the healing is happening. The only thing is, I want it to hold until the next time they come. So that's how you can tell that the person is going to stay better. So just basically for a few people, no matter how often I treat them, it doesn't seem to hold. But then I just feel like it's a puzzle that the person is. I'm just working on a puzzle there, and at some point, I'll figure it out how to get those extraordinary vessels to hold, the treatment to hold. And anyway, those people are getting something out of treatment, so it's totally fine. I feel like almost it's the way it's meant to be for that person at that time, that they are having treatment and we have this therapeutic connection.
So sorry, just just a quick follow up from that. So with them, you're saying half of the you're saying about emotional cases as well. So would particular extraordinary vessels be involved in emotional cases, or could it be any of them? Are there particular ones?
It could be any of them. I think all of them actually can be involved with it, with the emotional world. I have, though, probably more often than not seen the Ren Mai be involved with emotional cases. But as I mentioned, for this depressed lady who came recently, the Do Mai was definitely. I mean, it's so clear to me that it's a Do Mai now. Although when she came second time was yesterday, but when she came a week ago, she actually had 3 extraordinary vessels simultaneously present. So I had not seen 3 together at once. It was the Ren, the Do, and the Dai. So yeah, I mean, it was complicated. So it's not complicated to feel those 3 things together, but a complex pulse. I didn't know quite where to start, but I think things have clarified by this week. She wasn't feeling any better, but her pulse was feeling better. So fingers crossed, she's going to feel better after this week's treatment. So I'll keep you posted about how that is. Did that answer your question? Somewhat.
Yes, thank you. Yeah, no, thank you. Yeah.
No, it's a great question. It's a great question. You got a question?
So if it's a Do, it's very on the surface, under the skin.
Yes.
And if it's the Chong that is going to present itself, it's close to the bone.
Yeah, exactly. When it's the Chong, because you're feeling it's much, much lower, you're actually feeling through much more skin and flesh to get to it. So it feels more muffled. So it has got a slightly different feeling. It's right down by the bone in the 3rd position. So I'll go through the rest of the slides here now. So you'll see. So the first layer is the Do. As discussed, a very strong upward movement. The second one is the Ren. So you're pushing through to the middle. So the Ren is exactly in the middle. Now, the way you can do this is that when you're feeling the extraordinary vessel, if you think there's one of these midline vessels, you'll have a sense of it being very full and with an upward beat. Okay, then you could ask yourself, where is it out of three? So one way you could do this is that you put your fingers down into the middle layer, which is this Ren position, and see, is it there? You ask yourself, is it there in the middle? You can then go back out, pulling your finger back up again. See, is it here in the first layer, or go back into the middle and then go down to the third layer where the Chong is, and say, is it down here, right by the bone? So it's not exactly on the bone. It's basically halfway between the middle and the bone. So if you were to split this diagram, split the space into three, like just by the way, just the same as the three layers. The three layers are 3/3 of the pulse: the upper, the middle, and the lower. And remember, the upper is for the Wei Qi, the middle is for the nutritive Qi, and the lower is for the Jing or essence. So can you see that there's some sort of similarity between those three and this Du, Ren, and Chong? Because the Du is so kind of external and to do with the upper body, and so Yang. So I believe the Du is called the Sea of Yang. So it's absolutely about Yang and about Qi. So we need our Du to be strong. When it gets in excess, when we have an excess presentation, all we know is that it's in trouble. So we need to treat it. So it's almost like a mixture of excess and deficiency when this happens. There's usually deep deficiency in the system to cause the extraordinary vessels to show in the first place. So, don't be fooled. The person's may be feeling very tired as well, but the extraordinary vessels are showing themselves that they need help. Hope that answered the question. Did that answer the question?
Yes, somehow. Yes.
Good. All right. Okay. So only if there's an active imbalance that needs treating will there be an unusual excess manifestation of the pulse at one of these layers. So it's an active imbalance that is important here. And we treat it with the opening points. So these slides have also got the opening points in them here. So for instance, for the Du, it's small intestine 3. For the Ren, it's lung 7. And for the Chong, it's spleen 4. So that's a reminder for those opening points. This is a slide showing my original way of showing a pounding of the Ren there for insomnia, for an insomnia patient. So you can use the wavy lines to indicate a state, but you don't have to use diagrams at all. You can actually just write them out and say do my or die my or whatever for the notation. Okay. I think that's probably good for the moment. I think perfect time for a break. But first of all, I'll ask if there are any subsidiary questions coming up at this point.
Sorry, Jamie, just a quick one about the act. When you're saying active imbalance, could you say a bit more about that?
Well, basically, as I was saying before, it's actually happening right there. It's showing exactly what needs treating that day. Sometimes we might think, there's these different things going on. What I mean is by an active imbalance is that extraordinary vessel imbalance is happening right there and it needs treating on the day that you're feeling it. So My thought about this, which is an idea that Peter Ekman suggested. Peter Ekman was a teacher of five-element acupuncture, and he knew about these blocks, these so-called blocks to treatment, which are things like the AE, the husband and wife imbalance, and the entry-exit blocks. So these are kind of special things that can stop treatment working. Peter Ekman thought that the extraordinary vessel, extraordinary vessel presentations show a kind of active imbalance that absolutely needs treating at that time, and that you shouldn't do other things. So you shouldn't be like, well, I know it's like that, but I'll just do something else. So in other words, it's just giving you an instruction, like you have to treat the extraordinary vessel right now. That's the treatment for today. It doesn't matter whatever you thought you was going to do, you're treating that treatment right now. So, so going back to my insomnia patient, I'll explain more about her in a minute, but I mean, it's weird for me to have somebody, not insomnia, the depressed person. It's very strange for me to use small intestine 3 and bladder 62. I think I did the full opening and coupled for, although I look at my notes, but basically using something just like small intestine 3 for depression, I just wouldn't have thought that that was going to be what was going to work, right? But I've just become habituated now to trusting this method, and I find it really intriguing to see how it does work. So maybe later I'll be able to explain more about her. But basically, I've been following this now for, I guess, nearly 10 years, just following the extraordinary vessel findings, correcting them in the treatment room, feeling the pulse is different, and also then getting really good feedback clinically about it working. So it's like an ideal situation for a practitioner. It's direct. You can clear these things, and also critically, you get to know what the meaning of the extraordinary vessels are in the first place. You can get a sense of what they are, So in a way, we can have learning from a book, and this is another kind of learning from our patients. So it's totally ideal. Okay, great. Let's have 5 minutes and see you at 7:06.
Okay, so yes, we've just got a question here about really how do you distinguish the difference between a presentation in A3, the method of step
The levels.
A,
Yeah.
number 3, step A, number 3, the jowl, discerning that versus B1 and step B, B1, with these pressing down. So
Great question. Good question. Okay, so let's do the screen share. All right, so previously, okay, so basically what Karina was asking about was when we have these 3 steps, we've got these 9 sub-steps, got A1, A2, A3. So this is all for step A. And these, remember, are the strengths. So just imagine you were going to feel somebody who's got an actual extraordinary vessel and it's a Chong. When you get to, let's say it's a Ren, or somewhere in the middle. When you get to A1, you might have a reading like, it feels kind of big, maybe 3 or 4, and 4, so kind of quite strong. Middle layer, these A2 are for the 3 jowl, upper, middle, and lower. So that was no findings there. When you get to A3, when you're trying to do A3, you're actually diagnosing the same 3 spaces. So A3, remember, is got same pulse space in 3 layers, okay? Upper layer, middle layer, and lower layer. And you just kind of got a vague sense that there's fullness here in the middle layer. It kind of feels generally full. So here you could just say middle layer. That's likely to be what you'll feel. Then when you do the B step, B1 is actually basically the same as the same or similar in that it's the same three layers. So actually, when you then at the start of step B, I'm going to be sort of inviting you, or you have the idea then that you are getting your fingers on top of the artery. So the fingers then go on top of the artery. And now you're going to be feeling all around it and really get a sense of your fingers on top of the artery. Then you suddenly, when you do B1, you'll be much more sure that it's a Ren Mai, because you'll have the sense of the artery being right in the middle, but beating upwards. So that's the key thing. It's got an upwards beat. You can have a middle layer presentation being full and not have this upwards beat. So that's the difference. That's why this layer thing is more advanced than the free extras method. It's so easy to feel an extraordinary vessel finding when it's there. It's almost impossible to ignore it, in fact. Okay. I do have a case study that Karina and I were talking about, but I think I will bring it out later because we've got quite a lot more to cover. But that's a good question. Did that cover your? Yeah, good. All right, let's keep on going. So yeah, so basically we've now finished Du, Ren, and Chong. We'll leave it for the moment and then move on to the remaining 5 extraordinaries. So the other 5 extras. They are you could call them bilateral in that these other 5 are found on both sides of the body. So you may not have realized that, let's say we're talking about the yin and yin Chao Mai or the yang Chao Mai. Actually, you have a left yin Chao Mai and a right yin Chao Mai. There's a yin Chao Mai that runs up the left leg and a yin Chao Mai that runs up the right leg. So actually, this is actually 10 things we're thinking about here. So there are 2 of each of them. So yes, I know that's complex, but that is actually what this can diagnose. Or you can have them found on both sides, in which case you're simply finding the same finding on the left side and the right side. The daimai is interesting. You think of the daimai usually as kind of as one thing, but actually imagine the body is like this. The daimai going round has actually got 2 bits to it. It's got a left side and a right side. So from the belly button going round is one side to the left, and then from the belly button going to the right is the right side of the daimai. So it is actually got it's not necessarily the same on both. Difference with the daimai. And the other extraordinary vessels here in this list, the yin and yang Chao and the yin and yang Wei vessels, those are also founded on or the other.
Sorry, could you just repeat that? They can be founded on.
You can find them on one side or the other. Thank you. Yeah. So definitely the diagnosis can have a difference between the left and the right. I tend to treat both. I don't tend to use only one side for treatment. I tend to use both sides for treatment in terms of both of the opening points on both sides. But in my mind, I'm thinking it's showing on one side. I do have some nice cases that show this difference. Okay, now, what are the clinical findings? if it's so-called beating strongly. So by the way, this is all to do with the edges of this method. So it's to do with the sides of the artery. If it's beating strongly at both the lateral and medial sides in the first position, the distal position, it's a yang chow imbalance. So this is where the artery is like coming out of the sides of it. So the sides being like this, that side or that side. So you're feeling it's like expanding, or in fact, if you think about this do, the do was like this, and the ren is up and the chong is up. This is as if it's trying to escape out the sides. But that's the yang chow mai. So that's the most distal, furthest away one up the wrist is the yang chow. I just stay with this thing because it's quite useful. And if it's in the middle, it's a dai mai. So like strongly beating out the sides is the dai mai. The dai mai seems to show itself in the bigger way than the other two for some reason. I don't know why. And the yin chao mai is here in the more proximal end. So if this is a big version of what's in my arm, then the proximal version here is coming out the sides is the yin chao mai. Okay, any questions on that? I mean, that's complicated enough if you've never heard it before. No? Okay. And then
There's one question there, Jamie. So it's basically you're moving your fingers
yeah,
to find all these positions, or to find all these vessels, basically.
yes,
Trying
that's
to
right.
feel, as you're saying, the top of the artery or the sides, or
Yeah, that's right.
it's all in how you position your or our finger.
Exactly. It's how you position your fingers. I should show you something else now to make this clearer. That's a great question. Because when we are bringing our fingers down, in fact, we've got this. Okay, we have got, when we've got, let's say we're talking about the left artery, we can then imagine that we are feeling something that is like this. It's a tube, and it has sides, and you can draw, you could sort of split it up. So we've got the outer side, the inner side, and the top side. Okay, and the order of palpation is like this. This is the best way of doing this I have found, is with 9 presses. Okay, so I know this is complicated, just stay with it in a minute and you'll see more about how this works. And then, so these are the first 6. It goes like this: 1, 2, 3. Okay, so with the left left first finger pressing into 1, middle pressing into 2, the third pressing into 3, hooking and pulling, and then 4, 5, 6. Okay, and then settling on top, 7, 8, 9. Okay, so that these are sort of sectors of the pulse. There are 9 places you can feel. 1, 2, 3, 4, 5, 6, 7, 8, 9. So those are the 9 places you can feel. And what I'm getting at with this idea is that if you draw a sort of a small version of this, smaller. Okay, you've got 3 positions. And when it's coming out, both the top sides, sorry, the first position sides, then this is a yang chow. If you remember, yang chow means the stepping vessel for the yang. Okay, the medial, the lower position or proximal, is the yin Chao. So more distal is more yang, isn't it? More proximal is more yin. So that's why the more distal one is yang Chao and the more proximal one is yin Chao. If it's in the middle, then that's the daimai. Also, that makes sense. It's like a little version of a human being. Just remember for a minute that cast your mind back to the second webinar when we talked about the A2 step and we did the little diagram of a person. Okay, and with upper jiao, middle jiao, and lower jiao. So this is actually the same. There, the artery is split into three: upper jiao, middle jiao, lower jiao. This is the same sort of feeling: yang chao, dai mai in the middle, and yin chao. So it's kind of got a similar sort of sense of higher up is more yang, and in the middle is the dai mai. It's not 100% exactly the same, but you've got some sort of sense of this kind of topography or positioning going on here. Anyway, the main thing is you've got nine ways of feeling, and this is the best order: 1, 2, 3, 4, 5, 6, 7, 8, 9. Okay, now I know some of you might have the book that I wrote, and then this thing is in there. That's for the left hand. Otherwise, maybe just try and remember this. Karina, we could probably make available some notes for people who have not yet done the course. So we will make sure that is coming your way. Yeah, good. So now where was I going with this? We were talking about how to feel it and the way that the yang chao is manifesting higher up, yin in the middle, dai in the middle. You can notate this with a really simple way. Run 3 lines as if you've got 3 lines on your artery like this. Okay, and these mean the side. So this left one means the inside, the top side, and the outside. Okay, so these 3 lines on the diagram are the same as in the artery. And you can draw it like this for the left side. For a yang chao mai, you can just either do it like this, you can just fill it in, or you can do sort of shapes like that to show it's going out the sides. So that's my preferred way of doing it. And you might have seen those here. Oh, I'm still screen sharing. Oh, good. Okay. So you can see it fine, Karina? All good? You got a question?
Yeah, just going to say, so when you're feeling it with each finger, you're corroborating because it's both feeling it pushing out on the outside and on the inside.
Yes, exactly. But you have to push on the outside and then pull on the inside to feel it. So you've got to do all of those positions. You can also check one position at a time. So for instance, if you want to check only the dai, then okay, so this is towards the screen, towards inside is the wrist coming towards you. Okay. When I would be feeling it like this. I'd be pushing the artery this is the left hand, pushing the artery on the outside, and it feels large and coming towards me. I rotate over and feel on the inside, and then it's feeling large going towards the little finger. So I can go on the outside, lift, go on the inside, and it's large in both directions. And sometimes when a daimai is really extreme, it's like it's got a band that goes all the way around. I mean, it's absolutely amazing when you have a really full daimai. It's so large, it's so constricted, and really obvious. So basically you're feeling on the side. So you can isolate this way of feeling. Otherwise, you can do these 9 positions: 1, 2, 3, lift, 4, 5, 6, and at the top 7, 8, 9. And even though it sounds quite cumbersome, you can do this really quickly, like 1, 2, 3, 4, 5, 6, 7, 8, 9. Or in a smaller version, 1, 2, 3, 4, 5, 6, 7, 8, 9. So it does come out. It does come out that you could do it really quickly. 1, 2, 3, 4, 5, 6, 7, 8, 9. In fact, that's something that you can practice even without a person, is to get a pen and just try practicing pushing 1, 2, 3, lift 4, 5, 6, and the top 7, 8, 9 as a kind of little kata to try to get your fingers going as you want them to go. Then, of course, you have to use your right hand in the same way to use the right, to use the, sorry, you have to use your left hand in the same way to diagnose a right pulse. So 1, 2, 3, 4, 5, 7, 8, 9. And then you get ambidextrous doing that with both sides. So if there's anything that's difficult about this method, it's getting your fingers to collaborate with you and do that, because it's a little bit of a, it's a little tricky move. But you know, you get used to things and you can learn to do that absolutely fine. Yeah. So let's go back onto the screen. So beating strongly at both lateral and medial sides of the distal, Yang Chao, opening point, bladder 62. For the Daimai, opening point, gallbladder 41. And for the Yin Chao Mai, kidney 6. Okay, now this is where it gets really exciting, where it goes from one side to the other when it's felt, and this is a bit of a mouthful for me to read this out, but basically it's snaking up from the lower medial position to the distal lateral position. And for so that's for the Yang Wei Mai, and for the Yin Wei Mai, it's going it's going inside. So this movement is extremely cool. So I'll just show you what that looks like again. Okay, so imagine now this is going to be actually that's nearly perfect. That's good. So basically, for the Yang Wei Mai, it goes like this. It goes slanting outwards. The artery is actually not a straight line, but sometimes I get a very clear sense that it is doing this, that it's actually it's got a kink to it. It's that the artery is in some ways twisted. So imagine here it's straight, okay? And one of the features of extraordinary vessel findings is that it's as if the artery's got a kink in it. So the way it can kink is like this. Imagine I'm twisting it like this. I twist it like this. Can you see how it starts to deform? And it starts to go out at the top and at the bottom at the same time. So this, I'm absolutely certain, having done this for a while now, that this is actually happening, that it actually does kink in this way. You just feel it, and it sort of feels knotted. So if it's really extreme, it buckles up and goes in an upward direction as well. So it's a bit hard to show, but basically it rises up and then goes down the other side. So that's a Yang Wei Mai. A Yin Wei Mai does the other way. Either you feel it in a straight line, or else it feels like it's buckled. Yin Wei Mai pulses seem to be, from my perspective, less common than the Yang one. Okay, so how are you going to find this? Basically, as you're going about this 1, 2, 3, 4, 5, 6, 7, 8, 9, you will come across it first of all in the number 1 position at the top, and then 1, 2, 3, 4, 5, 6, and the 6th one, you feel it like that. So that's how it kind of presents itself, but you can also get a sense of it snaking up, and then that's how it works. In fact, Karina, do you mind coming in again, and I'll show on your arm. Any questions while she's on her way?
So just one, Jamie. So when you feel it sort of, you say beating strongly laterally, so you might still feel it laterally, but it has to be strong to be a finding. Is that right?
Yeah. Well, this is where, when I first started doing this, I thought it had to be strong for it to be there. But now I've got more sensitive. I'm realizing I can still feel it when it's soft. I would just then call it a deficient version of an excess. So, but to begin with, you need to tune your fingers in to feel it. So it's much easier when it's a large one. It's much harder when it's a soft one. So basically, pounding large findings are much easier. Okay, so look, there you can do this with okay, so the pushing and pulling, okay, isolating, and I'm just going to show you one finger, the yang chow. This is how you would sorry, start again. I could do it with this simple way, pushing and pulling, or with 9 pushes, 1, 2, 3, 4, 5, 6, 7, 8, 9. Okay, or you can do each one of these positions in turn to see if there's an extraordinary vessel there. So this is for the yang chow finding. Yeah, yang chow, like this, just first position. The dai, push, pull to go either side of it, or the yin chow, push, pull to go either side of it. A bit hard to see, but that's how it is. Yang chow, dai mai, or yin chow. And then if it is the one slanting, the way that this slant would actually be, sorry, do you mind if I? It's like this. And I'm not exaggerating that it actually is that big. Then you could either you feeling it large on the outside and large on the inside like this individually, or you can try slanting your fingers at an angle to feel this direction and the other way to confirm it's not going that way. And then you might think, oh, wow, it really is going out like this. Then that's exactly how it slants going out. So that's how much it goes out when it's strong. When it is when it's an excess, very excess finding, it goes out like this and it feels full. When it is more deficient, it still goes out like this, but it's soft. But you just need more practice to be able to feel it like that. It's harder to get the sense of it when you're just beginning. Some of you have been doing this for a while, though. I just wonder if I can ask Amanda. Amanda, sorry, do you mind if I ask? You've been doing it probably for 4 years now, I think, or 3 years,
That long?
something like that.
Gosh.
Do you have a sense that this is possible to do these ones?
Yeah, definitely.
Yeah. So
Yeah, definitely.
yeah, it is I mean, what I mean is, it is a reality. This is definitely, you can definitely do it. Using this slanted method is something I've been working on more recently because I think it makes it easier to basically rotate. Can you see what I'm doing? Rotate the wrist about the midpoint, which is just there. Sorry, rotating the fingers and the wrist, and then seeing if the artery is lying that way. And then you might suddenly feel like, wow, it really is here. So that's why in this method, I'm calling this 5 movements, because you've got the first movement, this, the second movement, this, the third is that, fourth is that, and the fifth is that, to be sure. And then you can explore. When it's there, it's really obvious. I mean, you could almost see it. Sometimes you can almost see it. It's quite amazing. And it really does have this snake-like appearance.
Yeah, I don't think it's 4 years quite, maybe 2 or 3.
Maybe.
Yeah. Because it was
Well, 4 years was
COVID.
COVID time.
Yeah.
3 years.
Yeah, yeah.
2 years. 2 years. Okay, great. Rena will come back to her. Where she is.
Sorry, Jamie. Sorry, just a quick one. Just following on from you were saying that difference between sort of a forceful excess finding and a softer deficient one. I'm just thinking if you were, I mean, if you were feeling the pulse, and this is a bit of a novice, it was a novice question really. So if you're
No, it's fine.
if you're feeling a pulse, wouldn't you normally feel it at the sides anyway, or would you not?
No, because
You would.
most of the time, well, no, the thing is the sides of the pulse are there. You might
Yeah.
feel it accidentally. You might not, very often people feel the sides of the pulse without knowing they're feeling it. And that for that reason, it can get really confusing. And if you feel some people's pulses, especially more elderly people, and especially people who are really thin, then you can feel the artery just like a tube in the body. But for most other cases, you can't you have to really concentrate to feel the artery. Once you've got the knack of it, that the artery is there, then it is easy. You can do it.
Yeah. Sorry, I'm sorry, I wasn't being quite clear. So if you're kind of feeling for the sides of the artery,
Yes.
even in an artery without any of these extraordinary vessel findings,
Yeah.
wouldn't you still be able to feel it pulsing outwards just because that's your normal thing? Or how do you tell when it's a finding or when it's just the normal pulse, which you can feel?
Oh, I see. Okay, so yeah, I totally got it. It comes down to this. It comes down to this word that's in the classics, and that's in the Jing. This word is exploding. So basically, it feels like the pulse is trying to. Look, I've got a larger artery here. It feels like the pulse is trying to escape out the sides. Like, okay, both with the with the dumai, it's like trying to escape upwards.
Yeah.
Those ones. With this, it's like it's trying to escape out the sides. When you put your finger on the on top of it, you might have the sense that if you had no idea about this thing, you might have the sense that it's very slippery or rapid or in some ways agitated, right? So you don't really know exactly what it is. Some people do this diagnosis by putting the finger on the top and then have the sense that it's vibrating from side to side. But it's much easier to put your finger on the side and then you have the sense that it's actually going out sideways, as if the artery is literally moving sideways.
Right.
In other words, the pulse inside is not just going up and down, but is literally going side to side, like it's trying to get out. The pulse instead of normally there's a beat inside, right? But this is like much more agitated and and you feel it on the sides. Basically, this is the kind of thing where if you felt it in a real person, there's no doubt about what you're feeling.
Right.
So
Yeah.
it definitely is the case. But the main problem is that most people haven't been introduced to the idea that the artery has sides. So therefore, you'll never know. So by being able to visualize the sides, you can then find these things and it will work for you.
Thanks. Yeah.
You're welcome. Good question. Where are we on the presentation? Okay, and here's this word, tan, which means springing. And it's also got this word flicking or exploding, and that's what's actually in the classic. So this is exactly what it says in the Jing. The front position, left and right, springing, is the yang chao. So if I'll just briefly show you, without getting into this too much, this says front position, left, right, springing or exploding is the yang chao. The middle position, left, right, exploding, is the dai mai. And the rear position, left, right, exploding, is, so left, right means the left and right sides of one artery, okay? It means the sides of the artery. That's how they're explaining it. They don't mean the left arm and the right arm. The rear position, left, right, exploding, is the yin chao. So that's what it says. I just think it's super cool that it's written down there, and that's exactly what's there, and you can palpate these things. Any questions? No? Karina?
Just so when you've said inside and outside, they're saying left and right.
Exactly. And this left and right terminology has had in the past caused some people to not understand this and think they're talking about the left and right arms. But if you just realize that you've already got these words front, middle, and back here, so they're having to use left, right to talk about this. I mean, you know, they haven't got these words. I mean, the words we use in English of radial and ulnar itself is really awkward, right? I mean, radial and ulnar, it's like really hard to work with those terminologies. So, in fact, this is easier, right? Left and right. Then, okay, the next slide is a little harder to explain, but and I will try, if we've got time, I'll try and explain it. But basically, this position is also called Xiao Yang, and this position is also called Shui Yin. In fact, I won't explain it now, but basically it means from outside to inside is the yin way, and from the inside to the outside is the yang way. And there it is in the Meijing. Super cool. And this is what these pulses look like with a real person. So this person had really bad back pain and was having trouble standing up straight. An elderly man who, in a general sense, is suffering from yang deficiency. Okay, so when people have got yang deficiency and they say they can't stand up, I often think about the do mai, and I was kind of thinking, great, this is going to be good do my presentation, but it totally wasn't. It still felt really big. In fact, there was something of the do in it as well, because it was just so much like a rope going up, but it definitely was moving out. Now, can you see how far my first finger is? By the way, can you see the cursor when I'm doing this, Karina? Yeah, you can. Can you see how far out this first finger is? And again here on the right, for my left hand, their right arm. It's really a large movement. So it's a large deflection of the artery. So it really was kind of poking out in that direction. This is what I wrote down that time. Jie mai meant the overall feeling for A was knotted. So look, this is, by the way, you don't have to do A1, A2, A3. You can just keep it simple and write it like this, A, B, C. So A was just that it was a knotted pulse. If I had been doing the numbers, it would have been 5 and 5 or 4 and 4, like really strong. It felt like a do mai overall. However, but it was not as strong as this very strong outward feeling of this motion. And see here it says C, not applicable. That's because you can't feel anything else after you've done this. All you can feel is how strong this do mai is. Even when you're on the A, you can feel, sorry, the yang wei mai. So this is a yang wei mai presentation because it's got this outward motion. And this is actually what his vertebrae were like. So he's got a really strong scoliosis that he didn't know about. So I think it's just a really fascinating thing that this movement of the artery has got this swaying feeling. I mean, I think this is one of my most exciting moments in the clinic when I thought he would just, I thought I was just going to do a normal back treatment. And he had this amazing scoliosis that he didn't know about. So that's why he couldn't stand up straight, was because of this weakness that was there. But it's just got this swaying presentation. Can you see how amazing that was to have come across that? So yeah, this was a kind of good point to realize this was an important thing. Okay, so I've said here in the slide, extraordinary vessels about 1 in 10 cases. I think it's a bit more than that. I think when I wrote this slide, it was a while ago. I think I'm seeing them more and more because I'm getting more. My fingers are getting more sensitive. So this is a statement about probably more about excess, very strong excess findings of the extraordinary vessels. I'm now thinking maybe it's just the people I'm seeing, but about a third of my cases or a third of my treatments have got, maybe a quarter have got these findings. When I find a pulse picture like this, I always treat it, and generally the pulse returns to a normal state. That means with no lateral or special vertical quality. So that means in all the cases where this is not there, 9 out of 10 cases of the excess kind, there are no particular signs generated by this or part 2 of this step. But it's still really useful to do this because it shows you the exact position of the artery in space. So therefore, it's really useful to do B, whether or not you think this finding is there. At least go through the motion of it to allow yourself for C to be really accurately on top of the artery. So by the way, C, you have to be on top of the artery for it to work. So that's why this is useful. And this is to say, without doing this step, you might actually be missing the artery when you go on to do the 5-level pulse diagnosis. So you could just miss it altogether. So just going back to just looking at this. Oh, this is good. Make it big. Going back to this slide, you can see this, right? See how if I put this first finger where next to the middle finger, thinking I was going to diagnose the heart there on this left hand, I would have then said this person's got a very weak heart pulse because the artery is not under the finger. It's not where I want it to be. The artery is actually moved away. So that's why if you're going to do the step C, which is the 6 positions, you've got to have the fingers over the artery. It's super important when they've got an extraordinary vessel, but you need to be accurate anyway when you do this. So a lot of the difficulty with pulse diagnosis is kind of like really unfortunate. It's down to not accurately having your fingers in the right position, rather than it being something kind of more tricky, I guess. So even if you get your fingers exactly on it, you can feel things really easily. All right, any questions at this point? I've covered so many things. No? Okay. So basically, yeah, I was saying here, without doing this step, we might miss the artery, which is important when you do this 5-level pulse diagnosis, which is really important in step C. But anyway, the normal 6-position diagnosis for the qualities relies on you being accurate. So if you're just generally feeling the area, you'll just get vague senses. But when you're really accurately on top of the artery, you get a very clear sense. Right, so we've only got a few minutes left. My goodness. The subject of the 9 the 9 pathways is quite complicated, and I don't think it would be a good idea to talk about it so quickly. So basically, I'll give you a little preview. These nine ways of feeling the pulse, which is for B3, actually have got diagnostic meaning in themselves. And it is definitely harder to do this, but it is possible and it's really rewarding. So I think probably this will just have to be left for another time. This is so much material in step B that this is the best use of our time just to stay with this subject. So we'll find a way of incorporating this 9 in my the yellow book. This is the 9 regions. I'm going to be calling this the 9 pathways because it's a more evocative phrase, and I found it in a later classic. It was described exactly the same, and I think it's really useful. 9 pathways. But anyway, basically, it's another way of finding important pulse information. All right, so let's leave that, and I will move on to, in the last few minutes, actually, let's do this case because I think this was incredible. Now let's just see if I can get it up. Hold on. Stop share and then share the photos. Cool. Okay, so I know you can see my whole application there. Doesn't matter. Right. So now, Amanda, you were here for this case because we had had this workshop. Remember the guy who was the silhouette artist? Okay, this is him. This is really, really interesting case. So if I could just, oh good, I can annotate like this. This is cool. All right, so his main complaint was breathlessness with a sense of choking. So he really was suffering from bad asthma and really had it was really affecting him. It was affecting him even when he wasn't exercising, just all the time. Now, with the channel palpation and just all his signs and symptoms, we were all thinking about tie-in. Basically, tie-in is the main channel that's got the lung in it. So this was a classic kind of tie-in picture. And that's what I was expecting. I was expecting him to have maybe a mixed excess and deficiency on the right first position for lung. So I totally was not expecting an extraordinary vessel finding. So this is where I think that it really is exciting to have this in the clinic, because you suddenly have got a different slant on pathology. So with step A, so as I mentioned, you can do this really simply A, B, C, just with writing A, B, and C on, and just for A, just do the strengths. And it was 4.5 and 4.5, which was nearly as strong as it possibly could be. 4.5 left, 4.5 right. And that was interesting in itself, because I thought he looked quite deficient. Man, did you remember how he looked? How would you describe his breath was and his whole presentation?
Yeah, he was definitely couldn't get the full words out, and he looked pasty and kind of just lifeless, hunched. Yeah, definitely looked really deficient, I thought.
Really deficient.
Yeah.
Now, it's really brilliant you mentioned the hunched, because that's how He seems, it's kind of like when he's got an asthma attack, he's kind of goes over with the top part of the body. But yet Amanda's exactly right. Weak voice, which you'd associate with lung qi deficiency, wouldn't you? And also he had was very tired and also had this white complexion. So actually, he had a textbook lung qi deficiency pattern at that point. So I totally was not expecting this 4.5 pulse. I mean, it's so big, and his pulse was so excess feeling in this upward sense. And as you can see here, I've written out do, and it was pounding both on the left and the right upwards as if it was trying to escape. And I knew there's no point doing C because it would have just been impossible to feel anything. Now, this because this was in a course setting, I thought I would actually do an experiment and only do 1 point. I normally do like to do more than 1 point, but I just thought it'd be interesting to see what happened. So I only did small intestine 3, and it was really miraculous. It just so soothed this excess pulse, and he just really relaxed. I mean, it was great. It was I think just one of those treatments where I was like, well, okay, this is really good. Don't you think about that? It was so cool, wasn't it? Because it allowed him to relax. And then I realized, now so far, if I just kind of stopped me talking and just let you guys have an opportunity to think about it, have you picked up on any of what I said about how he appeared and the do my from what I mentioned?
He had a hunchback. He was really bad.
Exactly.
Yeah.
The hunched back.
Yeah.
I mean, I just thought, wow, of course, he's got a hunched back. So in fact, the top of his back probably needs treating as well. His profession is cutting silhouettes, which means he naturally has got to look down at his hands all the time when he's working. So there are reasons why the top of his body would have that shape. And then it made me even more interested to realize that releasing his do my would be totally necessary to help open and nourish him, basically. So he has to release this to allow nourishment to come into his body. So then later, this is the same picture. And I know this is skipping forward to the rest of the method, but if you just stay with it, for those of you who've done it, you'll find this interesting. And if not, this is just a sort of taster for what's coming later. You see at the top here, this changed into 3 and 2. So it became softer, and I was able to let my fingers go deeper and feel the 6 positions. And he actually had a heart going down and the kidney coming up. So actually he had a heart-kidney imbalance. It was not at all what I expected with the lung, but his lung pulse was weak, and his spleen pulse was slippery. So there was obviously some phlegm and dampness in there. So from this, by the way, sneak peek, I thought he was probably a fire element person. I'm not sure, but this is at least his fire was maybe imbalanced. Who knows? This is the rest of the method will have these features. But just going back, can you see that I could not do the rest of the diagnosis without treating the do? But after like 10 minutes, the rest of the picture came out. And I think the people in the class were able to have their fingers on the pulse and notice that it shifted and softened as I was putting those needles in. So it really is exciting to feel those things. Other things to mention about this is if you think you have a do my, or if you think you have some of the other ones, you can press the actual point that opens it and see if pressing the point slowly and carefully softens the pulse. It should do. if you're pressing the point correctly. So that's a really nice finding, that you can feel the softening of the pulse like that. Right. So that is where I'm going to leave this this one. Question, Karina?
Wasn't he being treated for Ren by someone else?
No, I don't think he was treated for. I think he was treated just on the lung channel.
I thought it was Asper's kind of. Anyway.
Oh, I see. Yes, no, he had this point here, this Ren point. Yeah, but that point here is a point is not the kind of point for. It's not to do with the Ren. It's to do with the fact it's over the throat. Yeah, it's possible he had other Ren points that his practitioner did because of this point here. So it could be, but I guess what I'm trying to say with my method is that you're using actual signs in the diagnosis to get you to a clinical place that is a good one. So that's I guess why I think this is a really exciting method, a really exciting way that you can treat. So if you've got time, try to find some information about step B3 for those of you who have done this method, and just maybe review it. For the new people, I think we'll have to leave B3 for another time, or not do it. It's not totally essential. It's just extra good information. Okay, so any other questions or comments or observations? Magneld, are you have a sort of ghostly?
It has to be digested, this new material. But I think that in the middle jaw, it's very often very tight.
Right.
And it would be felt on the pulse, and then I would do the Dumai. So I think in a way, it's kind of the same.
It is. So just a reminder, the middle position is for the daimai. But
I did say Daimai, didn't I?
I don't know. You might have said that. I thought you said do, but it's okay.
Well, I'm a bit tired.
It doesn't matter.
Yeah, but in the middle position, if it's very tight, I would use gallbladder 41 to open the daimai.
Very good. Okay, so and why was it that you would be doing that anyway?
Because if it's in the middle jaw, it's very often very tight in so many people. They have held their breath and they are tight, and if you open it, they feel relaxed, they breathe better.
Brilliant.
And the stomach and the spleen goes the right way. Everything is kind of stopped here in the middle. Yeah.
Excellent.
So it's such a good thing to do.
That's totally true. So now you've got another reason or another take on the same. It's the same model. What's exciting about this, it does not conflict with the model you're already using. That area is already the domain of the spleen and the liver and stomach and yeah, you can see how when things go wrong, it can affect those things.
I think it's a bit difficult. This new
it is
information,
difficult.
I must admit that.
Yes. Now, Karina has reminded. Yeah, I mean, the thing is, there are so many layers to this, but the reason why I wanted to do this with the webinar method is basically it's better than trying to do it on the day of then showing it, because at least there's time to digest it and read about it, and it's a little bit longer. It's because it's new. This you might think, oh, it's so overwhelming, I can't do it, but actually, it's actually fairly simple. So Karina reminded me that this is especially for people who are doing our Tweenar course in Exeter, that we were talking about causes of back pain. Karina, would you mind telling the story of your back pain that you had?
Okay, so on the weekend we were staying in a B&B and the bed wasn't very comfortable. And anyway, on the second night, or I think it was the second night, I had quite bad low back pain just lying on the bed. And it was kind of a bit unexplained. And Jamie did the pulse and did 1 point.
Yeah, which was kidney 6. So pressing, but this is not even with needles. This is pressing kidney 6 really strongly, but the difference is if you just get told, oh, you could press this point, this acupressure point to alleviate something, you may not believe it. But what's really interesting is that if you've done the diagnosis first, you get this sense of like total certainty that it's going to work.
So which one was it? It was the
Yin Chow Mai. Thank you. Yeah. So this is a Yin Chow Mai presentation. So often Yin Chow Mai presentations have got something to do with back pain. It's one of my more common channels to treat with this step B. I mean, it's one of my most common step B findings, the Yin Chow Mai, and of course it does have also things to do with insomnia and also things like anxiety. So Yin Chow Mai is a very important vessel to try to understand a bit more. But in this case, this was for I mean, listen, as I was mentioning, I just follow the pulse. So it basically said, that's the channel to do. That's the point to do is kidney 6. So very strong pressure on kidney 6. What happened then after that?
Well, it actually just stopped hurting. I mean, it literally just worked and I could get to sleep and it didn't hurt anymore. It was amazing. It was actually amazing.
It was cool, wasn't it?
Hmm.
Yeah. So that's a great example of how you can use this pulse method to diagnose musculoskeletal things. And also it's kind of cool when it wasn't what you were expecting. I mean, I just like that a lot. But it does work as well. So that is brilliant. Any other questions or comments?
Just a point there, Jamie. I was listening to some of the and this is applied channel theory, but it's linked with kidney 6 because I was listening to some of the podcasts, Jonathan Chang and Jason Robertson, and they were talking about the Yin Chow Mai, and they were talking about that apparently Dr. Wang would say it was to do with the internal muscles, the muscles of the organs as well. So about peristalsis and sort of things, those sort of movements being constricted in some way. And so, that's.
No, it's interesting, isn't it? And then if you think that those internal organs also have attachments out on the inside of the back, how it's all, I mean, you start to get another richer story when you start to realize all of the layers that might be there with the organs when they're not working properly and the channels are not working properly. So this is what's nice about this method is you start to weave your own stories about the extras that are meaningful. And I think this is a shift in being a practitioner from being in a book and having your patients with being in your own method and your own practice and the patients and your own understanding. So you get to have your own idea of what those channels are rather than it being something that you just learnt about. So it becomes like a 3D model.
I feel I could do with sort of being alongside somebody sort of 24/7 for the next 3 months to kind of really get a sense, because I just feel on my own. I don't know quite, but you just have to keep going, do you think? And gradually
you do keep going. I mean, by the way, I did this whole method like that.
Right.
I mean, I didn't have a teacher. My teacher was my patients.
Yeah.
And the Jing, and also some pointers from Peter Ekman and William Morris, who said, this is a good way, but it's quite helpful. It's quite helpful being isolated, doing that. I mean, so there are many ways we can learn. So learning actually literally by practicing is a very valid method. And, but as long as you keep it real, keep on coming back to reality and don't go too like ethereal, I guess. But these are real things that are going on. And if the person feels better, then things are working well. Yeah. Good. I think we need to all go and have some sort of refreshment at this point, and see you next week for the last. Karina and I will figure out how we provide some other information about B3. So if that, we will provide it. So let's see what's possible.
Great.
Okay.
Thank you so much, everyone.
Thank
Yeah,
you.
thank you for coming. It was really nice to see you.